70% of all Medicaid lives are now enrolled in fully capitated risk-managed care plans. 40 states have at least one of its Medicaid populations in managed care. Kaiser Family Foundation reported that Medicaid is the largest contributor to long-term care services at 51% and growing. In 2015, Avali reported that 17 states have more than 1 million Medicaid beneficiaries enrolled in Medicaid managed care. And in 2015, almost 1 in 5 people in the United States is enrolled in Medicaid, and the number is expected to go 1 in 4 in the United States over the next 3 to 5 years, and that does not include dual eligibles.
Change is always a challenge. And let me give you an example of protections we put in place in California that I think that you would, if you were a financer, you'd like to know if those protections are there. If you are an owner, you'd like to know in your state you have some of those protections. So as an example, we used the fee-for-service rate is the floor. You cannot pay less than that floor. That is allowable. We said that you had to do authorizations within a period of time. You had to have prompt payment within 30 days.
And the entire state had moved to managed care except for the ABD community. So when you start moving everybody in that direction, one of the most important things that New Jersey did was what I call a trickle versus a flow. They didn't move the entire populace. Now we have a waiver program in assisted living. You have to take 10% skilled nursing capable residents in an assisted living through a Medicaid waiver that's somewhat funded. And that program went right away. But you can control. An assisted living person could take somebody of more high acuity, or they could toe the line and just do their 10%. And their market's not going to change as much.
I would say for providers, you have a unique opportunity to enter into a risk-based contract where you have significant upside. 70% of care provided in Medicaid is now in a capitated risk insurance model. The last 2 segments that aren't there, the biggest one is ABD, age blind and disabled. The ABD pop generally has very low penetration rates. In fact, MacPac, you may have seen, just put out their January report. It's about 20% overall. 5 years from now, it isn't going to be 20%. It's going to be 80%. And so the concept that you can focus on the state mandating a rate doesn't get you to where you need to be.
As we're going through the process and we're admitting our patients, we realized that once we started doing billing, it became chaos. My DSO, which is a matrix that we calculate what are dates of sales of outstanding, went from, we were about 35 in one of our facilities. The average is between 30 and 40. Right now it's 187.
Wow.
We realized we had to add another person to our team. So it wasn't only one member that we added, a case manager, to help us manage these patients, but it was also a billing representative to help us go through this process and, in effect, teach the IPAs how to bill.